We are here for motivational interviewing for mobile crisis teams, presented by Dr. Kristin Dempsey. And as you know, this presentation is presented by the California Department of Healthcare Services for the M-TAC mobile crisis benefit. The disclaimer: this presentation was prepared for the Medi-Cal Mobile Crisis Training and Technical Assistance Center M-TAC project, which is funded by the California Department of Healthcare Services, DHCS, and administered by the Center for Applied Research Solutions, CARS. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from DHCS or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the M-TAC project. And now just a quick review of this new mobile crisis services benefit. The mobile crisis service benefit is to provide a rapid response, individual assessment, and community-based stabilization to Medi-Cal members who are experiencing a behavioral health crisis. Mobile crisis services are designed to provide relief to members experiencing a behavioral health crisis, including through de-escalation and stabilization techniques, reduce the immediate risk of danger and subsequent harm, and avoid unnecessary emergency department care, psychiatric inpatient hospitalizations, and law enforcement involvement. Again, this new direction for mobile crisis services is to change mobile crisis services so that the response is more resolution focused and works to provide relief to the people in crisis in the community. Support people in crisis where they are while using the most least restrictive means possible. And here's just a follow-up that the mobile crisis services should be person-centered, trauma-informed, equity-driven, provide a brief intervention that includes de-escalation and remains resolution-focused, working from a lens of the least restrictive interventions, be culturally responsive, linguistically appropriate, and accessible to all. And welcome and introductions. If you haven't so already, please put your name, role, organization in the chat box and one thing you're hoping to learn today. And I'll turn it over to Dr. Dempsey, who will go over our agenda. Thank you all for being here.
Great. Thank you so much, David. Happy to be back. This is, I think, my fourth meeting with you all, and I'm really enjoying getting to know a little bit about the mobile crisis response community. And again, every time I see the introduction, I always think about how important it is at the work that you do. And I'm always having conversations. I have first responders in my family, and I'm training students to go out in the field and to do various roles. And over and over again, it's like, oh, the kinds of things we need are really the kinds of things that mobile response teams will provide. And motivational interviewing is absolutely an enormous tool in the toolbox. I spend a lot of my week training on motivational interviewing. It's one of my specializations, so I'm always excited to have this conversation. And as much as I train in motivational interviewing, I never get bored of it because it's such a dynamic, important, foundational, relational tool that has often like such great outcomes that I just feel very much because of my own personal experiences and the research and all that I see people doing with it, I just feel so good about providing all of this work. And so we have a tall agenda and not a lot of time, but I really believe that even an hour and a half, we can go over all the kind of high points. We can think about how it's relevant for your work. And I even was able to throw in a little bit of practice here. And to the extent we can, we'll get a little opportunity to practice. The thing that I'll start with and probably end with is if you want to become really great at motivational interviewing, it's all about practice. The knowledge base, I am willing to bet there's 64 people on this call, and I am willing to bet actually all 64 of you know the things I'll be talking about. There's terms, there's skills that you've probably been taught somewhere in your career and your education. And I'm going to help you think about how to really strategically apply them using MI. So you already got this. And again, the more you practice doing kind of this approach, because it's one of those things where it's simple, but it's not easy in some ways, right? Like the concepts are not complex, but actually do it in a way where we're really being open and reflective and staying out of our own way and not trying to fix problems prematurely. that's a challenging part. So the practice will really help, and all little opportunities, even today, will be important. So thank you for coming. And I'm going to start with a definition of what MI is. And it's changed a little bit. We have a new edition of the Motivational Interviewing book. Here it is. I have a picture of it in your slides. We'll talk a bit about the spirit of MI, which is really about our values and attitudes. We'll talk, a bit about the approach, which is really, thinking of the spirit and combination of skills. I will have us look at the main skills of motivational interviewing. We're going to practice reflective listening. We're also going to look at different traps to avoid. And there's another little piece in here within the skills and the MI approach is really being able to be aware of change talk, how important that is. So thank you for joining us if you're just joining. So in the learning objectives, briefly, we're going to be applying the 5 micro skills that helps promote conversations about change. Some of you may already know them. It's the OARS +1. Talk about that. We will think about, like, how do we create empathic and effective interventions? So I'm really talking about reflective listening and affirmation. We'll get a chance to look at those and maybe even practice a little. We'll also be thinking about change talk and what kinds of interventions can we use and when do we use them that help promote change talk amongst our help seekers. We will also be thinking about the spirit of MI and also be talking about 4 foundational tasks. So we'll have a chance to actually look at how we ourselves have experienced the spirit of MI, and I'll review the 4 foundational tasks in terms of what are we doing with motivational interviewing and when are we doing it? And we'll think about some of these micro skills and when to apply them, depending on what stage of change someone's in. And we're also going to be thinking about when we get stuck. And there will be times when we might be trying to do MI, but we're noticing that we're getting into maybe a power struggle with someone, or it feels, really tense. And we'll talk about how to back out of that kind of situation. Like if we're doing that, if we feel like we're wrestling, we're probably not doing MI in that moment. With MI, we want to really be in sync with people. We want to feel like we're dancing with them as opposed to wrestling. So that's a little bit about what we're doing today. And the material from this PowerPoint pretty much exclusively comes from this book. So this is kind of my global reference here. And this is the 4th edition of Motivational Interviewing, Helping People Change and Grow. If you haven't seen it before, it's not surprising. It just came out a couple months ago. Came out in August of 2023. So it's fresh, hot off the press. And so what is motivational interviewing? Well, in the book I just showed you, they've updated the definition, and it's actually become simpler, which is kind of interesting with all the work that's been done in motivational interviewing over the last 40 years. I'll tell you that in a minute. You would think in some ways, like, doesn't it become more complex? And actually with motivational interviewing, because so many people are using it now in so many contexts, they've actually really expanded it and maybe broadened the definition in some ways. So when I first learned MI, I mean, the definition included, like, it's a counseling style that's directive and it does this and that. And actually, they've just really kind of sorted it down to this, which is motivational interviewing is a particular way of talking with people about change and growth in a way that strengthens their own motivation and commitment. So what is kind of shifted in this definition is we don't talk specifically about people having to have goals. We do want them to have a direction, so we're not kind of all over the place. So you can be using MI even if you have someone who's just exploring, but they're trying to grow and trying to figure things out for themselves. Kind of perfect for mobile response. And we also stopped calling it a counseling style because so many people are using MI who don't consider themselves counselors. So I do MI training in schools. I do MI training with people in public health who are not counselors. I do training in primary care. I do some training in the corrections area, a carceral area, but not much. But there's lots of MI people who do training in that area. So we're using this for a lot of different things. And I was asked to, kind of, bring in some background of MI. So I have this data here fresh from a conference a couple weeks ago where the developers updated us. So to date, there's been over 2,500 controlled trials investigating the effectiveness of motivational interviewing. If you're not into research, that may not mean a whole lot to you, but let me just tell you, that's a lot. that's a lot. It really does help us start to get a sense of, is this working? And so many people are researching it, all kinds of things. So this includes over 225 meta-analyses. What's a meta-analysis? That's basically a research review. So with a meta-analysis, we're taking studies that are similar to each other and we sort them out very carefully to make sure that we're comparing apples to apples and really start to think about, like, do we start to see what we call an effect size, but do we start to see like something really shifting over the course of many studies? Like, are we really replicating things? Are we seeing like a movement in the data? And we're finding that, yeah, actually motivational interviewing for a lot of behavioral health interventions can be at least anywhere from like to have small to moderate effect size, which is pretty significant in the area of human behavior, because it's hard to measure like what's actually changing in human behavior. We're not always sure sometimes exactly how MI works entirely, but there is something that seems to be extremely important about this relational way of talking to people. So I won't necessarily read off each of the slides, but we've had over 130 books written on MI. There's things coming out all the time. Here's something that I think is really impressive, is that we have trainers worldwide. I just met some new trainers from around the world a couple of weeks ago. It's pretty exciting. And that we're training motivational interviewing in over 62 languages. And I used to have a slide where I'd have all these different MI guides in all these different languages. And there's been 4 editions of this text, which I'm showing you, and it's been translated into over 24 languages. So it seems as if cross-culturally MI is meaningful to people, right? If someone's going to make the attempt to do all of this training and all of this translation, it has to be meaningful. And what it seems like is happening here is that motivational interviewing is very, very person-driven. So it is really about the person who's being served. So there's a lot of ways then culture can translate. If I'm actually carefully listening to the person who's seeking help, clearly I'm going to be able to make adjustments based on their culture, because they're driving the intervention, not me. And that these ideas of reflective listening and affirming people and asking evocative questions, they seem to translate broadly. So I mentioned this a little bit in terms of what does all this research tell us, and in some of the places where MI has really established a lot of effectiveness is in the treatment of substance use disorders. So I teach substance use disorder or addictions. Sometimes they have different names. I teach these classes, and motivational interviewing is absolutely gold standard. It's what I start the class with, and the entire semester is like MI is really setting the stage for everything we learn. And it's important because we used to teach it around addictions in a very different way. It was much more about, you need to be in recovery, you need to be abstinence, much more confrontational. And that works for some people, but it doesn't work for a lot of people. And there's many people who don't get help because they don't like the confrontation. And MI has been an absolute game changer. It's opened up treatment services to so many more people who are now willing to participate. In healthcare, we're using MI a lot for health screening, dietary changes, medication adherence, physical activity, and weight loss, among others. There's also psychosocial applications. We're using MI to support people who are challenged with anxiety, depression, other SMI or severe mental health issues, behavioral problems, academic achievement, return to work issues, occupational performance, child welfare, and work with parents, amongst others. Again, I do a lot of work in schools, and I'm often working with school counselors and teachers and such. So it's a great tool, because it is having conversations with people about change, and it's their own change that matters. It's not about me trying to fix them. It's about me just helping them, move along in their process. And like, well, how do we do this? Kind of, we get under the hood here, like, what are we actually doing? How do we have these conversations about change that help with growth and exploration? People want to engage in these conversations. Well, first of all, one of the most important things we do is we have our spirit right. It's like our way of being. We come to the conversation in a way where we're open, flexible, and humble, which sounds easier than it is sometimes, because what we're trying to do is be very open and kind of person-driven in so many ways. But we're also, potentially facilitating these conversations. That's where our leadership kind of comes in, and helping people talk, the more people talk, the more likely they are to find their own solutions, talk themselves to change. We may be advising, but we do that in a way where we're trying to be in partnership. I can see our little image here, and seek collaboration, because the more we try to control an outcome, the more folks push back. And I'm thinking about this, especially in terms of mobile crisis response, or you have someone in crisis. Often the thing that someone needs is just to be in relationship with someone. I don't mean intimate relationship in terms of that kind of partnership. I mean just in like the supportive, collegial friendship, caring kind of way. And so that's where the spirit of MI really comes in. I absolutely believe relationships heal. And then the spirit of MI, if we look at this little diagram we have here, it's where kind of these four main components come together. And I'll explain them. And as I do, think about them for yourself. Think about them in terms of how you may have had other folks in your life support you in these particular ways. And my next slide, I'll ask you to participate around that. So the first thing's partnership. So I just mentioned that seeking collaboration. We try to, in motivational interviewing, we try to collaborate around everything. Clearly, you could have like a mobile crisis response situation where someone is in a situation where they can't, they might be, in fact, what we might call gravely disabled, and they cannot participate, or, communicate in a way that allows them to be able to do this kind of collaborative work. But in most of your cases, a great majority of your cases, you are going to be able to be in partnership. And even the smallest thing, about who they'd like to have in the room, or what have you tried so far? Hey, is there anything you'd like to hear from me? I have a thought about this. Would you care to hear it? Like those little queries about, hey, how can I involve you in this? It helps reduce a lot of pushback. It helps people feel more involved and less resistant, so to speak. People are not resistant. We create resistance when we try to force things on folks. So if we find a way to collaborate, we have more of that dance instead of the wrestling, which means that we might be talking about things that we will be talking about things they want to talk about. And it may not be exactly what I think should be talked about, but I'm going to restrain myself, put my needs on the shelf for a minute and just hear them out. Because often in that conversation, and they take the lead, they can often be more empowered. So we're trying to help people with empowerment to make choices for themselves when they can, to start to notice their strengths. And in the acceptance piece, through our active listening, like our reflective responding, understanding someone's absolute worth, noticing people's strengths, really being able to support someone's autonomy, that's all about being non-judgmental. And when people feel like unjudged, they're more likely, again, to engage because there's psychological safety. All of the spirit of MI creates psychological safety. I am more likely to talk with you, to work with you, to be engaged with a mobile crisis responder if I feel psychologically safe. And then finally, we have compassion. And compassion in this case really gets at, I am working for the benefit of this person I'm serving. I am trying to reduce their suffering. So there may be a program requirement, there may be some other, thing going on, the other blank I have to fill in at my work. But ultimately, at the end of the day, is what I'm doing serving this person. And this person maybe needs something different from what someone else needed 10 minutes ago. And I might have to be doing some advocacy. I might, be, moving or thinking about other things that I wouldn't necessarily be thinking about with everybody. But this individual, unique person, they might need me to do that. They might need me to be more flexible in order to reduce their suffering. So that's a little bit about the spirit, where they all kind of come together into the fact, to the extent that we're kind of holding all these pieces. That's what our spirit of MI is. And so I like to always kind of pause and have people think about this, which is, you're all successful people. You're all out there doing really important work, and thinking about like your own experiences in life, even if you've had really challenging experiences. Think about times when you've received compassion, empowerment, or been allowed to be empowered, partnership or acceptance. And think about a person in your life who helped you change and grow. What was their name, and how did you know them? And what ways did they help you change and grow? Now, I'm going to give you a minute to think about that, and please add to the chat box. Although I suppose it's also okay if someone wants to raise their hand and throw out something, and just kind of add in. So we have a little collection here of some of our own experiences with the spirit of MI. And I think many of us, if we think back on ways that we've been able to be successful, there's people around there who help support that. I don't think anyone's exactly self-made. Like we're all kind of made in community. So I'm going to go ahead and just give you a chance to add some of that to the chat box. Thinking about the people in your life who helped you change and grow. And as I talk and as I look at some of these examples, I may not be able to speak to all of them. So I encourage you to go back through your chat, kind of look. My first clinical supervisor, she always listened, offered feedback, was kind and knowledgeable. She never made me feel stupid. And Joy, this is so powerful. A lot of people will talk about their first clinical supervisors, like why they got into this field, because good clinical supervisors can do all that spirit stuff. They can accept people, understand people for where they're at developmentally. They understand that when you're starting out, you're not going to know everything yet. And so they have that acceptance. They also, offer feedback. And so offering feedback feels very different than like being totally told what to do, in a way where it doesn't feel collaborative. And often there's a sharing of feedback, or what do you think should be happening here? And that kind of conversation is really helpful for people growing. Absolutely. And hopefully, I'm thinking in terms of the being able to offer feedback and helping you grow, that you felt empowered by that. Generally, people do when they have a good supervisor, because they're learning how to be a supervisor themselves. And that's really exciting and empowering. And I love the idea too that she's really kind and shared her knowledge. Like there's a piece there around empowerment and compassion. Yeah, it was safe to make mistakes. And so, Joy, what you're bringing up here again is this idea of psychological safety. And we need it for everything. We need it in our own work, right? There's just like Joy did when she was developing. Thank you for a fantastic example. And that's what the folks that we're working with as well, especially with folks in crisis, right? Because they're coming in and probably feeling very vulnerable, not really sure. As you know, some people are really scared. They're not sure if they're going to be hospitalized. And so to the extent that we can slow things down and just have this openness and spirit and curiosity, can absolutely soothe folks. Yeah, so Michelle, look at some important people in my life, both ones that work and motivating me in my personal recovery. One counselor believed I could do this work and not lose myself. And so that belief in you, it's such a beautiful way of stating that, Michelle, thank you, is often a combination of all these pieces, but that trust that people can heal themselves. And it's hard sometimes when folks are in crisis, or when people have really been to a place maybe of difficulty, for us to be able to notice like this person's strong. They're going to be able to get through this. We're working on this in partnership together. And that sense of you could do this and not lose yourself, there's an acceptance there. Like, I don't need to control you. And there's also a place there where they're allowing you to be empowered. That you're able to be in charge of your own change. Yeah, these are great examples. For time, I'm going to move on, but feel free, folks. I'm sure there's probably a lot of people typing things in. Continue to add some things into the chat, and a couple of minutes I might come back and check again. So I'll say a little bit about the MI approach here. So you will see this in almost every motivational interviewing textbook now. It's really like how we begin and how we end with motivational interviewing. Like there's a process that we're going through that generally we engage people. And in the newest book, they have this little metaphor of, can we walk together, right? So when we're engaging, that's when you first come in generally. And it's like, hey, what's happening here? Help me understand. Let me listen. Let me be curious about all the things going on. And we often like start to collect dominant themes from people. Like, maybe someone is really under stress because of finances, or not worried about their housing, someone just left them. We're collecting those dominant themes. And then we're going to say, hey, given all that's going on, like, of all these things, what do we need to focus on right now? I think this is especially helpful for crisis teams, right? Because a lot of people, when we're in crisis, like there's all kinds of stuff going on. Maybe even some things that didn't seem like they're crisis are now crisis because I'm really worked up. But if we can help someone find a place of focus, maybe it's even just like one thing at a time that will help them, kind of move away from crisis for a minute. That is very helpful. And again, our little metaphor is, where are we going? What shall we do? What shall we talk about? And then once we have that area of direction, we get into our evoking stages. Let's go ahead and think about, why would we want to go there? Like, if someone's saying, of all the things that's going on for me right now, I really got to do something about my housing because I'm worried about being evicted next month. clearly it makes sense. Someone might be prioritizing that. So we then focus on their housing, or we focus on maybe a relationship issue, or we focus on their wanting to harm themselves, whatever might be kind of the main piece that seems like the most important. Sometimes we collaborate on that. Someone's really struggling. We maybe help them sort that out. Because once we get this area of focus, we want to really help them talk so we can start to listen for change talk. And change talk is anything that's like helps people move away from the current situation. So if the status quo is, I'm really stuck in my housing, I don't know what to do, I'm feeling really overwhelmed, I'm really scared. Some piece of change talk might be, I think I could find a place to stay next week. I really need to go down and apply for emergency funds. People are talking about things that might move them out of stuckness, right? So once we collect that change talk, it's easier for us to then move into a place of, well, how will we get to this place of housing stability? You came up with some really great ideas. You're thinking about getting some extra funds. You're thinking about talking with your landlord. You have some family who might help you stay with them for a bit if you need to. So given all that, where would you like to start? Right. So we collect the movement away from the problem towards change and start to help people think about where is the next step that you feel okay to go. But you'll notice that's not the first thing I say to somebody when I walk into their house, because they may not be able to manage that. Or when I see them on the street, I have to spend some time down there in the green zone of engaging with folks so they get a sense of safety, and I'm listening to them, and they can start to sort things out. So this is a 4 tasks kind of written out here, so you have this somewhere. Generally, it is linear. We tend to start with engaging and end with planning. And you'll notice on this image, I have like steps that we're going up, right? But it's also kind of layer cake because each one kind of builds on the other. And focusing kind of helps us determine, like, let's sort things out and not wander all over the place. Let's find an important topic of change right now. Given your crisis, what's the most important thing that you want to work on right now? That could be a good way of stating that. Then once we have that place of focus, start to think about, hey, let's talk a little bit about, tell me about what's so important about, managing this for you right now, and what kinds of things might you need to do. We start to be evocative and then reflect and really build the change talk so we can move into planning, which is what might be the next thing that you do. Sometimes I work with providers, we talk about the planning being a start of a treatment plan. But I often tell people, if there's like one thing someone's willing to do, and we have one thing for action, it could be the smallest baby step. That's super empowering. And for many people on teams, like that's a great place to get started. For those of you on mobile crisis teams, I think that's really essential because I don't think any of you are necessarily seeing people long term. So the next best step to connect or link to a resource might be exactly what you need to do to help move someone in, from crisis, out of crisis, into being resourced. Let me show you this as well. So you've probably seen this. I created this slide because people often talk about, well, the stage of change, is it motivational interviewing? It's not. Stage of change is trans-theoretical. You can apply it to any theory, any, kind of change process. But what it is, it's really this idea of thinking about, like, in pre-contemplation, people not thinking they have a problem. And then contemplations when folks are truly ambivalent. And then preparing, right, is when I'm getting ready to do something, right? When I'm getting ready to make that first step. And you'll notice my outline here, I guess it's a trapezoid. Like, this is the place, this is the land of motivational interviewing. This is the land of motivational interviewing. In pre-contemplation, where I don't think I have a problem, or in contemplation where I'm not really sure I have a problem, I feel 2 ways about it. That's often where we start with engagement. And then we like, help me understand that. And once we have folks who get focused and they're starting to be evocative and talk about their problem, usually they're more ambivalent. If someone doesn't think they have a problem, sometimes it's hard to get them to actually focus on it, because, like, why would I focus on it? I don't have a problem. So sometimes with folks who are pre-contemplative, I don't think I have a problem with drinking. I don't think I have a problem with my mental health challenges. We need to spend a lot of time in engagement. Right? And again, in a mobile crisis response, if you have someone who's really pre-contemplative and they're doing things that are putting themselves or others in harm, you might not be able to use MI right away. You might have to use something more directive to keep them safe. But the great majority of people, we start with the engaging, hey, help me understand. We can start sorting some things out. So they'll find a place of focus. And that the preparation, intent on taking action, as you might imagine, is strongly connected to planning. It's the same kind of thing. And then in action stage, I am actively, cutting back on my drinking. I am actively seeing my doctor. I am actively, going to receive a resource at an agency. That's often where we hope folks will land. And then maintenance is, how do people sustain their behavior over time? Right. So sometimes there's follow-up in mobile crisis response teams where maybe not the team, but other folks will follow up to see if folks are maintaining. Old school term, this idea of relapse, we actually now use the term recurrence, because relapse is a little bit loaded. But often what I tell people is relapse or returning to old behavior, it's a form of learning. It's not failure. It's only fail. I write about this. I'm really into this idea. I call FAIL. It's a little side here, but I think it's important. Which is first attempt in learning, which is very different than being a failure, right? So this idea that anytime we make a mistake, it's all something we can use. It's all grist for the mill. So if we have someone who just tried something and they're really frustrated or hurt, we can spend time in our response to them, like, what did you learn from that? And how can we use that to help you, move forward now? So maybe in my recurrence, or what I consider a fail, so to speak, maybe I learned that there's some interventions that don't work well for me, or I need extra support, or I need to try something else. And that's all material we can use in our response. I'm going to show a couple other slides here, and then I'm going to stop and check the chat box here for a second. So the process of MI, again, these are things I've kind of already reviewed. So, but they're just phrased slightly differently here. So again, with the engagement part, we're learning about problems and helping people feel comfortable with us. In the focus area, we're just trying to find that target, what they're willing to start with. In the evocation, this is a place where maybe we can start to hear some change talk, which we try to elicit it by being curious. And then the planning, there might be a first step in change, right? So for a mobile crisis team member, the area of focus is related to crisis, and the planning is typically some aspect of safety planning, right? In most cases, that's where this very concretely will be applied to your work. And so in the contemplation stage, although this could happen anywhere, I have think a little more specifically in contemplation, in preparation, but certainly this can come up even when you're engaging folks. Definitely by the time someone is in the evocation stage, on that plank there, you would maybe potentially start hearing words like I want, I wish, I hope for. And these are all aspects of change talk. So someone could say things like, I want to quit smoking, I wish I had a better life. One day I hope to stop. And so someone wrote in here, desire is not the same as necessity, which is absolutely true. And so the thing I'd like to say is that with change talk, sometimes we have two types. We have preparatory change talk, and we have activating change talk. I'm going to have to go. Oh, they don't have it here. Okay. I'll get back to that a little bit later. But with preparatory change talk, sometimes we'll hear people talk about things that they want, or they wish for, or they hope for. People are going to talk the talk before they walk the walk. So I can talk about what I wish and what I hope for and what I would like. And we still want to honor that and reflect on it and be curious about it, because that can be mobilizing. And at some point, what happens is if people are starting to envision their change talk, they're more likely to then move into what we call mobilizing or activating change talk. And the mobilizing or activating change talk is when people will say, I will do something. I'll consider something, I've already taken steps. So there's two types of that. And here's the important thing for those of you on mobile crisis response teams. What's important is just that you are noticing change talk, and that you're listening to it and you're responding to it. I'll talk about that a little bit more in a minute. Another thing to know that, and all of this, especially early on, especially when you first arrive on the scene and someone's in crisis, people are going to be really ambivalent. So I'm sitting with someone and they're talking about, how they just, they want to give up. They don't want to talk to anybody. They don't care about anything. They don't seem very ambivalent, but they probably are. And why is that? Why would I say that? Someone's sitting there talking to me about all the things that makes them upset. Any ideas around that? I'm going to see if anyone guesses that really quickly. Someone's feeling really negative, maybe even complaining a lot. Just check and see if that popped up in the chat. And the reason I say that is there's something really powerful that even with a lot of complaining or a lot of distress or a lot of agitation, Michelle got it. They're talking to us. That's right. They're talking. Absolutely. The fact that they're willing to talk to us shows that there's some ambivalence. So we have a real hope just by the fact that someone opened the door or someone allowed us to step out on the sidewalk and talk to them. And that, we think of ambivalence sometimes. Some people do as like, oh, feeling two or more ways about something, and I'm trying to get them to change. And, they have this problem of ambivalence, and that's like the glass half empty. I think it differently. I think of the glass half full, that if they're ambivalent, that means that there's a place that someone's willing to move away from the status quo. They're uncomfortable with how things are now. They would rather have housing. They would rather, have there's a stable mental health situation. Maybe they'd rather have a different relationship with substances. All of that is completely, totally, thoroughly hopeful. What I have to be careful to do is not try to persuade them to change. If I do that right at the beginning, like, oh, we should do this, or here, have you tried this, or what do you think you should do? Like, oh, let's do stuff. Let's do stuff. Right at the very beginning. Then what happens is that folks can start to push back, right? So what we want to do again is being engaging and being evocative, like, hey, help me understand like what's going on for you. The more people talk, the more they talk themselves into change. The more we have a chance to hear change talk that we can then reflect on. Yeah, absolutely. You have to listen first. Absolutely. It's all about this listening piece. Absolutely. Y'all got this. So we're gonna get the skills here in a second, but I just want to peek at something here really quickly. And I'm looking at Alexandria talking about Mr. Schramm, forget about our spirit. And so I love this idea of here's someone who took an entire classroom, right, and found ways to engage through encouragement and confident coaching. So this idea of like really believing, like in your class and your children, right? There's a sense of certainly acceptance that people are where they are. There's not this drive to try to control them, but there's like probably a very kind of loving place of finding different ways to help them learn, and that's empowering for sure. And it's just so cool too, because in this particular case, like you start to get into some people call, and I actually teach this in a separate class, spiraling upward. Sometimes people talk about, oh, I'm spiraling, and usually what that means, they're spiraling downward, but there's actually upward spiraling. And that's exactly what Mr. Schramm was probably doing, is that you all start to have little pieces of success, and it sounds like they were probably reinforcing what he was seeing, right? Reinforcing the places where kids were doing well, and it made it very, very safe. Very, very safe. And you all just kept practicing and practicing and practicing. And then, there you are at the end of the year, kids are playing music, right? That's a great teacher. Right? And we can do similar things. And then Bonnie's talking about Deputy Director of Behavioral Health Services. And it's always so wonderful to see like really good people be promoted into these roles, and empathic and supportive of my journey. And as a counselor supervisor now on the mobile crisis support team, she believed in me before I believed in myself. That's always like super touching. And so, part of that empathy, right, is like active listening, probably a lot of compassion there, a sense of understanding what it's like to work in the community, being able to probably notice and reflect on your strengths. That's all part of acceptance, and it's part of empowerment. So part of what I like to do with this, like help me, know about your favorite person, your favorite teacher, is when you're working with folks and you're in a different context because you're in mobile crisis, teams. And I know there's more pressure, and time is probably a little bit more, kind of collapsed than if you had a whole semester to work with children. But still in this place, like sometimes we have to kind of slow it down in order to move it forward. And I actually have a slide at the end on that. But that if you can think, what would my director do? What would Dr. Schramm or Mr. Schramm, or people in my life that were supportive for me, what would they do right now? And if we can conjure them up and get in touch with like their spirit, that can often help us in our very challenging situations, potentially also embody the spirit. Yeah, great. Thanks for that. Nice. Thank you for that. Thank you for the contributions. And if other people want to add more to the chat, I would love to see it. Okay, now we're going to get to skills for effective MI. So I was just mentioning this. This was a slide I was looking for, but I will come back and help us kind of think about this again. So we are in the skills of motivational interviewing. What makes MI is this idea of change talk. So what I mean is, if I am doing active listening and maybe even affirming people, like we do that in a lot of like person-driven work, like typical, like say, like Rogerian type of active listening type stuff, and it's great. It's good for communication skills. It's fantastic for relational building. You know, we teach people those skills in couples counseling. Let's say we teach people that in family counseling. Jobs will teach people in their retreats, to help employees like talk to each other. All fantastic. But what makes MI is this, and it's listening for the clinician, listening for change talk. So change talk is what the help seeker, what the client is saying, and I use my skills to respond to this change talk. So I have it divided. It is divided into darn and cat. So you got to see this a little bit earlier, but darn is like any desire, ability, reason, or need. I really want, to manage my anxiety. Ability, I know I could manage my anxiety. Reason, if I manage my anxiety, I'll feel better. Need is I have to manage my anxiety. I have to take care of my kids, and they need me here to be a good role model, right? So that preparatory change talk can start really early in a conversation. Sometimes it starts right away. Sometimes it starts when we're being evocative, like help me understand your dilemma. And when we hear it, we absolutely want to respond to it. And we respond to it using our skills, which will be in a couple slides. And then the cat is mobilizing change talk. And why this is different from darn is that darn in the research is important. We want to reflect on it because it leads to cat. But the cat is actually predictive of people actually starting change, people actually making change. And so cat includes commitment. In this case, my anxiety example, I will see my doctor tomorrow. That's something I'm committed to doing. Activation is like a kind of softer form of that. And it could be something like, I'm willing to see my doctor tomorrow, right? I'll try to see my doctor tomorrow. Doesn't sound as impactful, but it's on the pathway. And then taking steps could be something like, I call my doctor's office and they're helping me find times for me to see my doctor, right? So I'm not quite there in terms of committing just because I'm in the process, right? And taking steps, we want to support that. Great, you got this started. I'm a big believer in taking steps. I'm a big believer in sampling. If someone's like, I'm not really sure if I want to do that. You don't have to do that, but what if you did a part of it and we came back and talked about it? That might not be so practical for mobile response teams, but maybe there is a piece where if they're not the person talking to you and because you only see them once, let's say, maybe there's still something they're willing to get started on, and that can be part of their safety plan that they follow up with someone else, right? Their little steps can be important part of safety planning. So there's a couple of slides where they're putting some evocative questions that we might ask that would help generate change talk. So in motivational interviewing, we talk about our skills, right? We talk about open-ended questions. We talk about affirmations, which I'll go over, reflections and summaries. So sometimes you hear the ors, right? And these are examples of open-ended questions. And the thing with questions are good. We just have to make sure not to ask too many of them, because even really good questions, we can over inquire, and it starts to shut people down. People don't want to hear too many questions. But these are really helpful because these could be questions that could be evocative, that helps people maybe think about what could be a next step in change. Again, I tend to, and people have different styles around this, I tend to reflect and listen first, and then do some reflection before I start to ask a question, right? I want to have enough data, enough knowing of what's going on for someone before I start to ask them about change. Because one of the mistakes that people make in motivational interviewing is that they get excited about, okay, how might you want to make this change? And that's the first thing they ask somebody, and they're not there yet. And so they start to push back. So here's the thing, here's a good little pro tip for motivational interviewing. If you notice, and you should always notice how your responses land. And if you notice people start to push back, or they start to like stop talking, or it starts to feel like you're wrestling a little bit, stop doing what you're doing and go back to like reflective listening, just trying to hear their story, being curious. Because often what happens is if we start to question too much, or if we ask a question too soon, people will shut down a little bit. Also, if you have a lot of I don't knows, like you're asking people stuff and it's like, I don't know, stop asking questions. Usually we're asking questions and people are saying, I don't know. And it's okay. I do that too. And that's how I find out. They really don't know. I don't need to be asking this question right now. I need to be doing something else. And sometimes I'll just do some reflective listening. Like it's hard for you to even imagine how to answer that question right now because you just really simply don't have the answer to this particular concern. I do that reflection, I step back, and then I just try to listen to more of their dilemma before I start asking these questions. But these are good evocative questions when we get there, like helping them envision, helping them think about how they might do it, what are some good reasons. There are scaling questions, like how important on a scale of 1 to 10. So if someone says it's a 5, what would help you be a 7? That will help you get a sense of how important is it. You'll also want to know, sometimes, let me get back up here because I may not have put this in here, how confident is someone able to do something? So something could be really important to me. I could really want it, but I might not be confident in it. So sometimes I also need to ask, in addition to how important is it for you, I need to ask, how able are you to do this on a scale of 1 to 10? I'll put it in the chat box. And so why do I do that? Well, because if I know that something is maybe not important to someone, I can always check with their values and be like, how is, doing whatever you're doing. So maybe in my case, like, how is not managing your anxiety? How is that helping you, work towards your value of being a better parent? Let's just be curious about that. And so there may be some discrepancy that I'm developing between their current behavior and their value. If it's about confidence, like on a scale of 1 to 10, like I'm a 2 in terms of managing my anxiety, well, then I can maybe start to think about inviting them for some skills training. Like, what would help you be more confident? I have some thoughts about this. I have some opportunities or offers that I could provide for you that would help you manage your anxiety. Would you like to hear those? And then we can start to negotiate that. So you can see it's a little bit different. With importance, it's about motivation, how much somebody wants. With confidence, it's about skill. And maybe we're about building skills there. So you want to be able to ask and look at both. So I just put this in the chat. And with these micro skills, we use these micro skills to respond to everything a person says. And we are at some point, when we start to hear that change talk, we use these micro skills, even more to gradually increase our response to change talk. Have to be careful, because if I go right away into like just trying to seek change talk and do it really soon, like 5 minutes after, 2 minutes after I see someone, it might be too soon. So thinking about the time that you have, sometimes even a good 5-10 minutes of just hearing someone's dilemma, then you can start gradually moving more into reflecting, responding on change talk specifically. And these are the tools you would use. So open-ended questions, I just showed you those. We have my metaphor here is an open door. Open-ended questions opens the door to other responses. Closed-ended questions are like the yes, no, right? Yes, no type questions or specific information. Those are great when you're gathering information. Those are great when you have to fill out a form. Those are great maybe when you're doing an assessment. But once you're done with information gathering, it's so much more important to ask open-ended questions. And sometimes, there's a lot of research around this actually. It's better to put the assessment stuff to the side for a minute, start with open-ended questions like, help me understand what's going on for you. Often the assessment info that we need, we can get from an open-ended question. So it's not just sitting with someone who's already maybe really agitated and asking them a bunch of intake questions, which often can make people more agitated. So sometimes an open-ended question of like, hey, help me understand what's going on here right now. I can see that you're really distressed, can be a great way to get at a lot of information, but it's relational as opposed to assessment based. So the distinction is with closed questions that might be more assessment oriented, like I'm asking people to give me something, like here, give me some information. But when I have things, that are more relational, it's like there still can be a give, but they get to choose when I ask open-ended questions, like what they give me. And again, there's some closed questions we have to ask at some point, right? I don't tell people like, tell me a few things about your phone number, right? It's like I may need to get what somebody's phone number is or what address are they at. So clearly, just common sense that there's some things are going to be closed. But if we can ask fewer questions and have them be more open, that's a good tip. Affirmation, I use my magnifying glass. And what that is about is I am noticing this, like I have a little magnifying glass. I'm looking for people's strengths. Again, I want to really support that because I know their problems. They've come to me with lots of problems, maybe. But what I'm really looking for, what I really want is their strengths, because I want to leverage their strengths. Their strengths is actually what's going to help them get out of this situation. If people don't feel like empowered, if they don't feel like they have the ability, if they don't feel like they have the strengths, the skills, it's hard to do something different. But if I'm able to notice their competencies, you're a strong person, you have courage, you've been able to problem solve these things before in the past, like that builds efficacy, and self-efficacy is really strongly related to change. Reflections, I have my person in the mirror. We'll notice little reflections in a second. Reflections are really the backbone of motivational interviewing. You can't reflect enough. And it's really the act of listening of you tell me something, I take it in, I decode it, and I mirror back a different response to you. But it has, but it has the meaning of what you're saying. So it's not, I'm not parroting, I'm using some different words, but it's basically, some aspect of what you're saying. And when people hear that, there's a sense of safety of like, yes, you're tracking me, and people often keep talking. Summaries, I have the bouquet. It's often we pull together ideas and concepts, and summaries help us clarify and sort out and move forward. Summaries can be very helpful in terms of organizing and helping with focus. Let me see if I've heard everything you said so far, and kind of pull things together and help someone kind of move along in a process. And then my last one is actually it's ask, offer, ask. So the elicit piece you can remove. We call it AOA. It's called ask, offer, ask. And what we're doing in ask, offer, ask is about how to give information and advice. Okay. And this is how we're like thinking about information and advice instead of just telling people what to do, because that's often pushed back against. We ask what people want, we ask what they've already done, and we ask permission to give information and advice. I cannot tell you how critical this is. And this will be really critical for mobile crisis teams, because even though you have to give a lot of advice sometimes or information, or you have a safety plan, we want to get buy-in, right? And so this idea of, I have some thoughts here. Could I share them to you? We have some options and different ways you could respond to this. Would you like me to help you sort that out? Like when people are in crisis or anytime really, it's like they need to have some sense of control still. So if they're able to say yes and no and provide permission, they are going to engage. If we just tell folks what to do, you can start to get into a lot of like, yeah, buts, right? Like, yeah, but kind of thing, right? And people pushing back. And so here's some options for open-ended questions that folks have included. Again, with this idea that open-ended questions, you help people tell stories in their own words. And this is an important piece that we want to be sparing with open-ended questions because we can ask too many, right? So if I just start, asking open-ended question after open-ended question, it can still close people down because again, I'm still asking for people to give me stuff. Reflections, I'm giving. Reflections, I am giving my attention, my awareness, giving support. Whereas questions, it's like, give me an answer. Right? So a good guideline is ask no more than 3 questions in a row, and to be able to really sandwich questions with reflections. And I think I have that here for you as a slide for you to remember. And we have to be able to, you know whatever answer that people give us. Clearly, we want to be open to whatever the answer is, right? Because people can say all kinds of things. And the best way to be really kind of like non-judgmental, so to speak, when someone gives us an answer to the question is just reflect on it, just reflective listening. So that way we're not saying, oh, that's good, or well, why didn't you do this? We're just like, okay, so your relationship with your parents sometimes is really rocky. And if you've found ways in the last couple of years to help it improve, right? Like that might be a reflection to what I just asked here about, what can you tell me about your relationship with your parents? And you can see the difference between those examples there, right? The did you, have you, could you, may you, are you, those things will close up a question. Whereas if I ask, tell me, often what and how will be open. When and who, sometimes it depends on how it's taken. It can be taken as either open or closed. Like if I say something like, when do you find yourself feeling the saddest? Someone can actually, maybe elaborate on that, but some people might just say like in the morning, right? So we can't always control how people are going to respond, but that's just something to think about. Like for some people, like they are going to, even when we ask, an open question that we intend to be quite open, still won't give us a lot of response. So just to let you know that. And here are some examples around open-ended questions. And so a lot of these are really good. And I think that what concerns you about your situation is really great when you're in like the engaging stage, right? To help people really express themselves. What's the best thing could happen to you if you made a change? That might be working in the evocation stage. That's not the first thing we want to ask someone. What's the first step you can make to change? That's something I want to ask really more towards the planning stage. And what's one thing you could do right now to move toward that goal? That's a planning stage question. We do not want that to be the first thing we ask someone. Because if you ask someone in crisis and you haven't built that relationship and you haven't spent time listening and helping them focus on what it is that's going on, if I ask someone what's the first thing you could do right now to move toward a goal, it'll be like, I don't know, right? I mean, they're too overwhelmed. They haven't had a chance to really think or talk about it. And again, this can feel like I don't have the time to go into this, but a little bit of discussion actually, even like I said, 10, 15, 5, 10 minutes can actually help folks get to a place of being able to maybe consider some change steps, but not the first thing we do when we come in. Just a little tip there, that can be very helpful. And then early on during contemplation, again, contemplation is feeling two ways about something. And this idea of validate their lack of readiness. Well, another way of framing that is just being able to reflect on their ambivalence, reflect on both sides. And that's actually a really great intervention called the double-sided reflection, which I'll talk about in a minute. But we can just be really aware with someone like, like on the one hand, you're really upset and overwhelmed with being really anxious and feeling kind of stuck. And on the other hand, you're starting to notice that you're getting tired of this, and maybe you're thinking about some other ways of managing it, right? So I have the status quo as someone comes in, that might be one aspect of their lack of readiness. I have change talk on the other end, and that might help them move in that direction at some point. There's also the evaluation of pros and cons, the desired behavior. And in the research, there's been some mixed kind of results around this. Sometimes evaluating pros and cons really early, like in the engagement stage, can be overwhelming, and it makes people more ambivalent. Be careful with that. They found that evaluating pros and cons sometimes can be more helpful when people are actually becoming more firm in their decision to change, and it actually helps reinforce some of their changing. So that might be a great thing to build confidence in like the early planning stage. So just be thinking about that. And again, you'll notice some people right away, like they might, want to do something like that and they're ready for it. But for some people, we have to be careful around that. And then identify and promote new positive outcome expectations. I think it's important for them to identify their own new and positive outcome expectations, and we can help reflect and build that. Again, sometimes if I do that, and I'm saying, here's some things that you can be doing differently, or this is what might expect, and if I kind of get ahead of them, they may not be ready. So I want to start to hear that language from them before I step in with that. So we're going to practice a little bit. Again, we don't have a lot of time, but we're doing fine. And I think any practice is great. Any practice is really important for building motivational interviewing skills. So I love having a chance to do what I call chat box practice. And it's a nice, quick and dirty way to kind of get into practicing, usually in a way that most people feel pretty comfortable participating in, and it doesn't require, anyone being on stage practicing in front of the whole group or anything like that. So I'm going to have you type into the chat box, like some typical statements, like maybe one or two sentences altogether that you might hear from a help seeker or client that you work with. And when I say one or two sentences, I mean, you can always type in the things that we hear people saying, like, I don't want to talk to you right now, which is fine. But in addition to those kinds of statements, something that has maybe a little more that I can respond to. I will show you how to reflect on, I don't want to talk right now. But for more complex reflections, maybe give me, a couple of sentences that you might hear from folks. And I'll continue to keep talking here, but I'm going to use your responses in the chat. And okay, Andrew, thank you. It's off to an excellent start. And the reason I do this is because in addition to practicing, giving us a chance to practice, I also like to, when I train, go to the teams I'm training with and say, hey, you give me some examples, because these are your particular experiences, right? I want to be very specific to what's up for you on the mobile crisis response teams, as opposed to school counselors I taught yesterday, right? Like you have different examples. Yeah, okay, great. So folks are adding some great content. So first of all, reflections can be simple. And a simple reflection is one where maybe I just restate or repeat an element of what the person says, or I rephrase. I state what the person says, but substitute synonyms or slight rephrasing. Okay, Missy, that's a great one too. Got a little Discord going there. So I'm looking back at Andrew's, nobody cares about me, what's the point? And maybe my restatement would just be something like, so nobody cares, right? And I'm just like reflecting back what I'm hearing them say, and I just reflect back that little piece of their statement. And it's simple. It's almost like like an encourager, like saying, yeah, but instead of being kind of an empty encourager, it's actually like part of what they said. And it often, helps people, you've heard me, I just said, this, what you're hearing what you said, and they'll often start talking a little bit more. If I rephrase that, I might say something like, it's hard for you to, even think about why you're here, because you don't feel like it matters much to anybody anyway. Right. So that might be a slight rephrasing of what they're saying. And like, why would I do any of this? Well, the reason I do this is because it's tracking people. It's helping them get a sense that I am actually hearing and understanding and responding to their content. And that often encourages people to continue talking. Right. So it's like, I've just, mirrored. It's like, yeah, you're getting me. What could be the problem with this? Well, simple reflections can be a problem if they're overused. So when I go to trainings and I have people tell me, oh, I don't do active listening anymore because I've had people get mad, or it just goes in circles, or, it feels like I'm just parroting. So I don't do any of that anymore. And what I tell folks is that the problem is not your active listening. The problem is that you're only doing simple reflections. You want to then move on to complex reflections, which I'm going to show you in a minute. But simple reflections have a role. Simple reflections are great when you first get to meet someone, because you don't know their whole story and you're just trying to track like what their dilemma is. So I would imagine for many of you kind of pulling into a scene, whether you're going into a house or on the streets, you'd be using simple reflections for a bit just to make sure like you're hearing somebody's story. Then at some point, maybe a few minutes in, they are going to have to be more complex, because it is going to sound like you're just kind of going into a circle. Also, simple reflections are great for people who might be a bit activated or angry at first, because sometimes if I start to do something too complex too soon, certainly if I start asking questions, certainly if I start defending my position, they'll start getting more agitated. Like the one here, or or I try to explain something. I already told the doctors and nurses. Yeah, well, I know you got that, but now you need to tell me. Like, I don't want to tell you anymore. Why do I have to tell? Why don't you share your resources? I just really hard, but I really have to do this right now. Like ultimately we may have to do something like that, but what if we just pause and was just like, this is really hard for you to have to go through all of your information again. Boom, right? It doesn't mean I've said I'm not going to collect any information, but I'm just going to reflect for a little bit. And some of this might be like totally legit. Like if someone did go and tell doctors and nurses all this information, like, there might be a spirit compassion piece there where, yeah, is there a way I could get some of this stuff? Or is there something additional that I have to do that's different from the doctors and nurses that then I could, I could ask them. I was like, I understand how really frustrating this is. There's some reasons I have to collect some of this separately. Is something a little bit different. Would it be okay if I explained that to you, just so you know? And we could ask them. They might say no, but often with that, like, I understand how this frustrating could be to keep talking. Like that can be a way of kind of soothing some of that agitation. Right? Doesn't mean we have to change all our policies or do anything different. In fact, many times we shouldn't, and you're doing things for a particular reason. But it might be just pausing, slowing down, reflecting is a way of helping someone feel heard. And the simple reflections can be helpful. But probably many of you are noticing, okay, again, like this is just going, in a circle pretty quickly. So that's why we want to have a toolbox of complex reflections. I have some here that I absolutely love, that are really, really useful. Continuing the paragraph is one I think we use probably the most often. And this is a method of reflective listening in which the provider offers what might be the next as yet unspoken sentence in the person's paragraph, for example, and that made you feel angry. And so maybe I'm thinking, and Michelle's, I'm just going down the chat box. I already told the doctors and nurses, and it's really frustrating for you to have me start to ask you even more questions, right? That might be the thing that person potentially would say if they were to continue the paragraph. And I'm just reflecting that back to them. And again, some of these are not hugely complex because I don't have all the context. I'm tired of feeling this way. And you would like to have some solutions so you don't always have to feel really depressed. You don't actually care. You're just paid to be here. It's really hard for you to trust me right now and what my intentions are. Right. So these are all like things that could be said that might be the next piece that are maybe, kind of underneath the surface. I don't want to be a bother to anyone. And so it's really hard for you to ask me or anyone else for help right now. Right. These kinds of things are so powerful. Like they will move along a conversation. I don't think I'll have time to show you this today. And I wasn't set up to show a video in this particular training. And this is typically behind a paywall, but it's not behind a paywall anymore. So I don't know. People have found it on YouTube. So if you go to YouTube and you look up you'll find this this video. Some of you may have seen it before. And it's Bill Miller working with a guy for about less than 9 minutes. And this person is like, a one sentence, maybe 2-word kind of person. He's not a big talker. And Bill uses almost entirely continuing the paragraph reflections in order to draw him out. And it's a fantastic piece of work. And it really goes to show like how well you can use reflections for someone who probably would recoil if we just asked a bunch of questions. Right? So complex reflection, continuing the paragraph, really helpful. And then just to move along here, I'm just going to show you metaphor and analogies. Like metaphors are great ways also to intervene because it helps people see and hear themselves without it being exactly about themselves. Like we're storytellers. We use language and we're human beings. Human beings use language, which is like amazing. And that, in the language, there's stories, there's parables. And sometimes it's easier for us to understand metaphorically instead of having something like directly talked about ourselves. Let me see, I'm trying to think here. If I find some here that, let's see. Trying to think if there's something here that I could really use a metaphor for. Let's see. That would be appropriate. Again, you wouldn't necessarily use metaphors for everything for all your responses, whereas continuing the paragraph is pretty useful for many responses. But you know, trying to think if there's a good one here. Like I say, maybe some of you are actually seeing some of that you could actually use. But I'll give you some examples. You know, like often people come in and talk about feeling like just really stuck. Maybe I'm tired of feeling this way. Might be one of those. You know, where it's just like, you know, it's like, you know, you're just tired of like, you know, spinning your tires and not getting anywhere, right? That idea of like spinning your tires, or, you know, being really stuck, or a sense of like, you know, sometimes people feel like they're really stuck or isolated, or, you know, out at sea and you don't have any paddles to kind of row back in. You're just feeling like very, you know, kind of up the creek kind of ideas. Off that one often comes up. Another one the other types of metaphors I often use with people is like when folks are struggling like for direction, you know, the sense like it's really hard. It's like you're kind of out there and you don't really have a map or a guide to get back home. Like some of those types of metaphors can be really helpful. And I often use a lot of metaphors too that my clients themselves come up with, and that I'll run that metaphor through like a number of different kind of parts of the conversation, and they can really stick with it. Like it really helps people, you know, it's their language that they're using to understand their situation. For many of you, also, you're working with culturally diverse communities, so thinking about like metaphors, analogies, parables that are really relational to that community. So people will have like their own, could be religious, spiritual, other cultural stories that maybe you know because you're of that culture, or you know the culture well enough where you feel comfortable enough to use that. So often, you know, people's dilemmas are often couched in some of these stories. You could use that. A big one, you know, one that's common as an example. That's another one I use. I don't necessarily use like the word Sisyphus because people don't understand, you know the name of Sisyphus necessarily, but the idea of like pushing a rock up a mountain, you know, not being able to get anywhere. Like a lot of people are really familiar with that story, you know, with that parable. So I'll talk about, you know, it feels like you just keep pushing your rock up and you just can't get a grip. It just kind of keeps rolling down. You keep just feeling stuck and like it's not going anywhere. Like that's a great image for people to think about. Like they can often relate to it. I talked about this before, but the double-sided is like such a great reflection, because what the double-sided does is it provides a bridge. So I'm telling you like, oh, we're starting with often sustained talk, the status quo, where people, you know, are coming in and they're doing a thing, or you're seeing them, you're out visiting them, and they're, you know, they're anxious or they're overwhelmed or they're unwell in particular ways in crisis. That's the status quo. Change would be doing something to help resolve a crisis. But like, how do you get from point A to point B, right? How do I get from me being really anxious to me maybe talking to my doctor about my medications, right? Like there's two places. And again, if we're in a situation where I have to be thoughtful and careful about how I give advice, so people don't push back against advice, I have to be careful that I'm not asking too many questions. So another great tool here is a double-sided reflection, right? So I can reflect the status quo of what's going on now and reflect the change talk, and it links them both together. And so what can happen is change is more likely to occur if I don't overly reject the status quo. If I reject the status quo and just move way too fast and like, okay, so what do you think you'll do? What's your next plan? Then it's like, but you don't understand. I'm really anxious. I can't do anything right now. I'm really overwhelmed with this. Like, you know, or there can be like, yeah, sure, I'll do whatever you say, and then not do anything. So the double-sided could be something like this. Like you could use it on the one hand format. You don't have to. Like on the one hand, like you're just really anxious and it's really hard and you're feeling really stuck right now. And on the other, you're considering some options, including getting reconnected with your doctor. I did two things there. I used and instead of but. I also used the change talk in the last thing they heard, getting in touch with your doctor. So getting in touch with your doctor, I want that to be the last thing. I want them to know, you know, I'm hearing you around your situation right now, around your anxiety. I'm not pushing that away or making that minimal. And I'm also putting out this thing that you said you could do, that you might be willing to do, to kind of maybe potentially start to tip over to that side. You know, I'm starting to link them now, so maybe we can start talking about that change talk at some point. It's an important bridge, because otherwise, if I just talk about change talk too soon, then the person has to defend. But I'm anxious. I can't do that. I'm anxious. But if we put them both together, it's an amazing thing. It fits. So again, that gets to why did I use and not but? This is a really important thing. So for the chat box, why did I use and instead of but? And while you're doing that, I'm going to give you more examples. There should be in quotes, but for time, I just typed that in. Makes both true, that's right. And what happens is if I put but in there, yeah, but invalidates, exactly. So someone will start to defend their status quo. So maybe I'm thinking, I don't know all the context, but I'm looking at Sam's 10:05 example. I don't want to be here anymore. Maybe there, depending on the context, there might be something like, yeah, I'm here, you're like, you're feeling stuck here, you want to get out of here. And, you're willing to, I'm seeing that you're willing to talk right now with me with some options for some other things that you might be able to do. And let's see, I don't want to be a bother to anyone. Sure, I understand that you really don't want to, cause a lot of problems. And I'm also hearing that you have some willingness to talk with me about maybe some options. And you'll notice in these little statements, many of these statements that y'all are putting in here are status quo statements. So the change talk that I'm inserting is very process oriented. I don't have the words for their change talk. I don't have it here, but I'm using myself and the fact that they're willing to talk to me as like the indicator of change. I'm tired of feeling this way. So I get the sense you're really exhausted and you're done with this. And I'm also hearing that potentially, or I'm seeing that potentially there's something we could work on to help you not feel this way. Okay. Yeah. So so I'm looking at all the other chats in there. Yes, but does imply negativity. And Michelle wrote in here, when we do the and, it helps someone stretch where they're towards thinking about it differently, right? Like both things can exist. It doesn't mean I have to just only see like this part of my life. Maybe there's some other possibilities. So that's a pretty brilliant one. There's also understating and overstating. Understating might encourage someone to say more, and overstating might encourage someone to back down from a position. So for instance, let me give you some example here. Something like understating. I don't use either of these too much. So like, I'm not the problem, it's my family, they're the problem. So I might say something like, so there's some concerns you have with your family. Like that kind of understates it. And probably if I said that back to that person, they would feel really compelled to just be like, well, I have more of some concerns. I mean, they do this and this and this. And so sometimes I can flesh out their concern by understating. An overstating is if someone is like really stuck in like a status quo and it's just very like they got their heels dug in, and sometimes they're like it's almost like they're trying to entice me to like try to convince them or try to move them from their position. So I'm thinking of Sam's like, I don't want to be here anymore, and maybe my overstating is like, this is the last place you ever want to be, right? And so if I overstate it like that, there isn't really anything else to argue with me about, right? I'm not trying to convince them like, oh no, this will be fine. Well, we just have to work on this, or well, why do you say that? I'm not getting into any of that. It's like, this is the last place you want to be. You really want to get out here as soon as possible. And that often, has people just kind of backing down. There's no point to continue to argue with me. So with the overstating, don't use that for everything. Like use that only for people who are really kind of dug into the status quo. The things I really recommend using a lot is like the paraphrase, which could be in simple reflection. I just kind of paraphrase what people say. The continuing the paragraph, and the double-sided reflection. And to the extent that it seems appropriate, metaphors and such. So in our time here, I'm going to move on, and we're going to do practice with affirmations. And if we get time, I don't know if we'll have it. If we get time, I might come back to reflections a little bit. So I try to squeeze in a little more exercise if we have time. But let's see where we're at the end of this. So affirmations are statements and gestures, really statements that we're talking about here that recognize a person's strengths and acknowledge behaviors that lead in the direction of change. And no matter how big or small, they build confidence, and that they need to be genuine and congruent. And to some degree, like it's a bit of self-disclosure in that there's things that we're noticing about someone else. We're noticing their strengths. So I'm going to have you do something for me. I'm going to have you put into the chat box just like one word strengths that you notice amongst the people that you support. So you're out there, you're meeting with all kinds of people in the field potentially. What kinds of things do we want to do? Courage, great. Thank you for getting that started, Alexander. What other things? Resiliency. Resourceful. Insightful. Great. Sober willingness. This right here actually is a great little exercise just for people to do. I mean, every now and again, and maybe you do it like every now and again for a staff meeting, because it helps people start to notice and think about the strengths of people that they're working with. Often when we're doing support, it can just feel like a bit of a grind, and we're often dealing with people's problems. A lot of times it's nice to like just notice the ways that people are really incredibly strong. The survivor pieces, their creativity, their humor, all these great pieces. And now the next step of this little exercise is we're going to put a link in the chat box, and it's on the slide, which I don't, you may not be able to, it depends on how you're set up in your office, but you got a link, and we're going to have you click on this link. And this link is going to lead to a Jamboard. And if I could have show the Jamboard on screen for a second, that works. I want to just show folks how to do this part. This is a great little exercise. So there we go. Perfect. So what we do with this is I have the flight attendant there in the purple frame that she has the seatbelt there. And you're going to practice both doing affirmations and creating open-ended questions. So at the bottom of your screen, so you're going to click on a link and you're going to have a browser show up on your screen. So it won't be the screen you're watching right now is a video. So you're going to have your own browser that you can manipulate. If you go down to the right-hand corner of your browser, you're going to see a little plus sign and a circle. You click on that and it creates a pad for you. And on the pad, you can pick one of the affirmation words that you had in the chat box. I see people are joining the pad, which is great. And you write in at the top of the pad the word. So I have two examples. I have caring and grounded. And then you write in an affirmation that when expressed would be supporting, would be expressing that particular affirmation. So for caring, this person wrote, "I've noticed that you care a lot for your friends and family." Yeah, that's something that someone does, and it's kind of a simpler affirmation, but that's cool. And then grounded, the person wrote, "I've noticed that you've been able to remain grounded during this emergency." Someone put this together when we had a flood emergency, and so yeah, that absolutely is showing someone's strength. And then you also add, before you publish it, you can add an open-ended question that, when asked, would generate conversation about someone's strength. So they don't necessarily go together. This could be something separate that I might ask someone, and this person says, "I'm curious, what are some ways that you show friends and family that you care about them?" So if the person were to answer that question, we're going to see like how they're caring. And then the grounded person did, theirs was, "I'm curious about some of the techniques you use to keep yourself grounded through tough times." Right? So if someone answers that, they're going to talk about their groundedness. So for a few minutes, I am just going to have you go ahead and fill out some pads. And so here's another cool thing. That link that you have, you can keep that link. You can bookmark it if you like. And I'm going to keep this Padlet open, indefinitely, I suppose. I don't know how long they'll let me do it, but I want to keep it open so you can go back and you can look at it. And when you're working with folks, you can get an idea of, refresh your memory and see different examples of affirmations, both how to state them and then how to actually ask an open-ended question that would evoke strengths. So I'm just going to be quiet for a moment while people populate this Padlet. And it's pretty cool when you're done. It's like there's a lot of different things on here, and it's a great resource. I used to, back in the day, I used to have people, do these in groups, and then I'd ask people, "Oh, could you make a list of all the great affirmations?" But of course, no one does. It's like, it's too much work. but this is great. You're creating your own resource for yourself. So when you're done, you can have this. And it's like the other exercises too. Usually, when they start coming in, they all come in together. Yes, we have the courage. Acknowledge how brave you are to seek help and allow our team to support you during this difficult time. Yeah, it takes courage to ask for help. Yeah, nice. And that's really, I really like the courage kinds of affirmations anyway, especially for like a crisis response team, because often people are feeling, very much like, what's wrong with me? I'm weak. But the reality is actually takes a lot more strength, right, to be able to do this and to ask for help. Yeah, and also some people are adding GI gifts into theirs, and that's fine too. Put a lot of thought into this and so much insight to how you get here. And you clearly spend a lot of time thinking about this. What are some insights you can share with me about how you arrived at this place? Yeah, so you can have people kind of help think through how they're exploring some of their ideas, insights. Might spend like another minute here, and then I'll move on to the slides. But do come back to this and continue to add, and we can check at the end of the course as well and see how much this has grown. And see how people have kind of built out some of these affirmations. So again, an affirmation is a statement. And it's a statement that's really looking at these strengths. So it's not a question, just to give you that guidance. Because of time, what I might do is go ahead and go back to the PowerPoint. Have tech kind of bring me back to PowerPoint, but you can still be adding to this slide while I am talking, if you so choose. And when we go back to the slides, I'm going to go into a little more detail about affirmation. There's some examples that some folks provide here about affirming responses. And I am going to make a distinction here, because this is new in the newest guide of motivational interviewing, that sometimes we have simple affirmation and we have sometimes more complex affirmations. And simple affirmations are more like the things that people have done. So this idea of like, I appreciate that you're willing to open up and talk today, or that's a good suggestion. Those are affirmations, and they are more like simple affirmations because more about things that people have done that have been, positive or helpful. And then things that are more about enduring strengths that someone has. And that's what I had you do on the Padlet. Something that's more about like kind of who the person is. Like, you're clearly a very resourceful person. And I'm not sure if the second to last one, if I were in your shoes, I don't know if I could have managed nearly so well. That'd be a little bit on the simple side. It could be a little more complex about someone who's able to manage well. Certainly the last one, it takes courage to face such difficult problems. So the second one and the last one, they're more what we consider complex affirmations. And again, with the more complex affirmations, it's kind of closer to like the person's kind of character. Whereas the simple affirmations, certainly there's nothing wrong with them, and we certainly want to encourage those, but they're more like literally simple. Like, they're more about like the kinds of things that maybe someone has just done once or twice, and that's, or maybe they're doing it consistently, but we're noticing and reinforcing some some behaviors that may or may not be consistent with who they are, but we want to give them credit for it. So a couple of things then about summary. So we've talked about open-ended questions, we've talked about affirmations, we've talked about reflections, and now we're talking about summaries. And summaries are a really helpful aspect of reflective listening. And summaries are really helpful for collecting, organizing, and linking information. So after someone's talked about a particular topic, and maybe talk about their personal experiences, and it's helpful to be able to see, let me make sure I've gotten this straight, and make sure I have everything so far, and be able to get a summary. And what we're doing strategically sometimes is like organizing their thoughts. So when someone first comes in and I'm helping them engage, if I summarize what it was that they've been talking about, these are some of the dominant themes, is what I've been hearing. Then for me to think about, of all these things, what should we focus on today? That helps me move from engagement into focusing. So summaries are really strategic that way. Also later on when I'm in evocation, right, and we're talking about maybe change talk and all the different things that they're willing to change, if I can summarize that change talk, it really helps me move into planning. So again, if I tell someone, oh, well, we should do a safety plan, like that may or may not be well timed, but what if I did this? We've been talking for a while and you've been telling me about all your anxiety, and it's been really hard on you. And what I'm hearing you say is that you'd really like to get your anxiety under control because your kids are relying on you and you want to be able to be there for them. You have had a doctor before and you're willing to talk to them again about your medications and just other aspects of treatment. And if you're able to get your anxiety managed, then you'd be able to go back to work. So given these things, where would you like to start first? Or given these things, what do you think you'll do next? So what I've done is I've summarized all that change talk. And now when I ask a question that might boost somebody into planning, it makes sense. It's not out of context. It's not like I'm just telling somebody what to do or asking them what they think they should do when they're like, I don't know. I've been talking about these things and I'm kind of confused. I've just summarized all the things they've been talking about so it reminds them and it helps them organize it. And it does help us, get this sense of like, are we communicating well, as we start to move towards change? It can be very helpful. And so there are some statements you can use that help folks, move towards summarizing. Like, let me see if I understand so far. You can then do your summary, or here's what I've heard. Tell me if I've missed anything, right? So you can then do your summary. And is there anything else that you would like to add in terms of summary? Please go ahead and add that into the chat box. There might be some pieces. I'll just give you a minute. Maybe some folks are up to doing that. I'll give you another minute to consider that particular piece. Not seeing anything come up in the chat. Yes, doesn't mean that folks are not adding that, but maybe just in order to move along a little bit, could be something like, so we've been talking about a number of things over the last few minutes, and I'd like to make sure I captured everything. Another good thing is I'm linking, today we're, just want to check in with you again. I know last time I had checked in with you, we're talking about such and such, if you have an opportunity to see somebody a second time, that kind of thing. Or, I know we've talked with you a little bit and I talked with your parents some, so let me make sure I have everybody's concerns all in order, right? So if you've been talking to a couple of different people, which might be really happening if you're in crisis. Yeah. So again, if there's anything else that comes up, please add that. So you want to be concise in your summary, and use language in terms of the person in crisis use. Clearly, we want to do that throughout. And there can always be an invitation at the end. Did I miss anything? Is that accurate? What other points are there to consider? Anything else you want to add or correct? Perfectly fine. And then Andrew has a nice one here. This is what I've heard so far. What, if anything, am I leaving out? Yeah, those are all great. So some common traps. So I'm going to be able to kind of come to a little finish here and maybe even have a little time left over, not just for questions, but for some practice. And Michelle's also added another great example. Let's make sure I have all this together. Yeah, and do your summary. So despite our best intentions, sometimes we can get into traps that foil our efforts. And again, this idea of like using like a lot of reflection, finding places to affirm, pulling things together with summaries, like this takes a lot of intentional practice. Our main comfort zone for many of us, and I don't want to assume it is for everybody on this call, but for a lot of us as providers, is to give information and advice, and to also ask a lot of questions. So being able to do the ors really well, it takes time, and it's easy to kind of slip away from that, or to get kind of overwhelmed, or to want to go into problem solving mode. So one trap is like to lecture, or I don't think anyone's necessarily like lecturing and trying to be an expert, but sometimes even with our best intentions, like we start to give information, and I do this as well as anyone else. Like I'll notice people are starting to glaze over, like it's too much. You might be feeling that way right now. And so that's an important piece. And remember, the person that we're working with is an expert on their own lives. And so we give little doses of information. And I'll definitely show you that intervention next. Persuasion trap. Sometimes we take responsibility for someone doing something, and we get into persuading when we have an agenda, right, when we come in, or we feel compelled to fix someone. Now, clearly, there is an agenda when you come in from, to some degree, for mobile crisis, right, that we want to help stabilize people. And, but just, we have to kind of put that just aside just for a moment, enough to where we don't get in our own way of persuading. Clearly, if I'm talking to someone, I'm going to listen to them, letting them lead. And this is where we start to figure out, like, after some time, of like, someone isn't able to, take advantage of resources, they're not able to engage in safety planning. Again, like, if they might need more intervention or higher level of care, that can certainly happen. But we want to, if we need to use extra time, if we can't, to use extra time in order to avoid the higher level of care. We want to consult. We don't want to automatically do that, of course. We're trying to use all of our tools before we go there. And we just want to be careful of, like, the persuasion sometimes can feel like, I just got to get there. And that gets to my next trap. And we want to be careful not to get caught up in that. Beware of the traps. And so the time trap. So trying to force someone to move on our schedule instead of theirs, in addition to trying to persuade someone, this is how we create resistance. So this is tough, but I love this little quote from Dr. Miller, although I think he may have gotten it from somewhere else. But I use this: if you act and feel like you only have a few minutes, it may take all day. If you feel and act as though you have all day, it may only take a few minutes. So there is something about that thing that, again, we have someone just out in the space, like psychic space, physical, whatever, and it's like the sense of, like, I just gotta kind of push or pull you along, and it's like, I don't want to go, and then that push and pull becomes time consuming. Whereas if it's like, hey, just help me understand what's going on here, that's someone in their free form just telling us, and we're just reflecting on things that actually, because we're dancing and not wrestling, it actually moves. It's almost like greasing the rails. Here's a metaphor. We're kind of really moving it more quickly, towards a potential next step. And then there's a wandering trap, which I told you about, that sometimes this can frustrate change and growth because we're wandering all over the place, and different things are coming up. Totally makes sense in a crisis situation that this could happen. So again, when we engage with folks, we might be wandering some because we're trying to figure out all the things that are going on, helping them feel comfortable. But that's why it's so important to summarize those dominant themes and then move into focusing. Of all the things you got going on for you today, where can we start? Because if we start on one thing that helps them feel some comfort, that helps them take a step forward, that can go a long way in terms of reducing crisis. And it's challenging because we have folks with lots of crisis. We can't solve everything for them and all the time, but we want to be thoughtful how we do this. There's one last thing that I want to show you as well, and I'm recognizing for some reason I had it in my slides, but I just recognize that it's not here, and I need to show it to you because it's really important. And that is this idea of the ask, offer, ask. I'll put it in the chat. So this is how we give information or advice. So how does this look? Information and advice. The first thing we do is, like with the ask, offer, ask, is we ask, like say I want to give someone some information or advice, which happens all the time, right? The advice would be like, let's do a safety plan together, or let's there's some resource I have to give you. Would you like to have it? Information might be maybe they want to know when a certain resource is available, whatever, and you have that information. So this is a central part of your job, is giving information and advice, I would think. So the first ask is, what have you already done? Right? So someone's already done this. I'm not going to keep asking them to do the same thing over and over again. If then I ask, like, what would you like from me? Maybe there's some actual information and advice that they actually want that's actually relevant to them that I wasn't going to give them. And then finally, I want to ask permission to give information and advice. So let me ask you. So this is how it might look. This first ask, and the ask, offer, ask. So I'm hearing you say that you're thinking about let's say I'm give back you about managing your anxiety. I'm wondering, like, what have you already done to manage your anxiety? What kinds of things are you doing already? And maybe they tell me, is there anything you'd like to know from me? And it's like, no, not really. I don't really have anything else. Well, I have some other thoughts about managing anxiety, based on some work I've done and things that we know. Would it be okay if I offered those to you? And that's really critical. That asking permission is absolutely essential for folks engaging, as opposed to being like, no, that's okay, right? No, I don't need it. Yeah, but that's not going to work, right? That kind of thing we actually ask, and now their ears are perked up. They can always say, no, I don't want your information, in which case it's like, that's up to you. That's your choice. If you do want information, I can certainly give you some. Because if we start to force on folks, then there's that pushback. Almost always, people will agree and say, yeah, what do you got? I'm interested. And then what we do for the offer, if it's information, make it brief and concise. Right. So we don't want to offer more than, say, like a paragraph at first of information. But put brief and relevant. If it's advice that I'm offering, I want to give a menu of options. Maybe like even 3 or 4 things. Right. And then let them choose. It's really, really important that we're seeking collaboration, and then we're supporting their autonomy. They choose. And that makes all the difference in the world. And I have had folks I've worked with who are like, yeah, but I don't want to do anything. There's nothing ever helps. Nothing ever. Nobody helps me. Nobody supports me. Nobody cares about me. And I was like, well, it's totally up to you, but I have some idea. Would you be careful? Okay, what do you got? I'm like, well, here's this menu. Here's some ideas. Yeah, whatever. No big deal. Okay, well, anything else you like, just let you know. Like, I'm happy to go over more ideas. And then I find out 6 weeks later, they've been doing things off that list. But it was done in such a way that they got to choose. There was nothing forced. They started to think about it afterwards. They weren't all angry about it, because it's like, this is what you got. Now, again, in a mobile crisis response, you may have some folks who need more direction because they are, they're potentially going to harm themselves or someone else, right? So, the choice we may have to give someone is like, we would like to talk to this parent or this family member, that family member, while we're talking to the doctor, kinds of things, right? Like the choice that we're giving and some of the advice or guidance might be very constrained around, what we need to provide to keep them safe. But again, if we have folks who are able to regulate, they're in crisis, but they're willing to, they're doing safety planning, they're willing to step back. That's really helpful. Thinking of your safety plan. What kinds of things would you like to have on your safety plan? Have some thoughts. Would you care to hear it? Well, here's here's a couple people you can contact in the community, maybe someone else you contact in your personal life, maybe some online resources, any of these things you'd like to put on your safety plan, and then they get to choose. So there's this dance that's going back and forth, right? And so the final ask, that's the final A here, is feedback. Like, what do you think about that? Is there something in this advice that you'd like to choose? If this information I gave you, was it helpful? Would you like more? And so we're constantly doing this dance back and forth of like, I got the knock on the door. Here's something, would you like this? Great. Do you want some more? Wonderful. Where it's all about us negotiating how much and what way they want information. So that's a really powerful type of response, especially for teams. So, in action here, again, looking at our time, so we're almost finished up here, but you're thinking about using, of course, a person-centered approach at all times to support people's autonomy and working towards change and resolution. They go that even when we have to be more directive and we can't be precisely person-centered in that regard because of their safety, we still try to find ways to collaborate, still try to find ways for folks to be involved. And that using, the brief motivational interviewing supports people in their current state and helps them build what they need for their future state. And it's really empowering, right? So it does help, reinforce their strengths and such. It allows them to explore reasons for staying and for changing certain behaviors. It promotes engagement and trust. And again, that relationship between provider and a help seeker, like that's the medicine. I talk about like you being the medicine all the time. There's no medicine that works as well as us engaging with each other. Like humans need humans, and that's really seems to be pretty consistent. And that said, some people are also going to have medications as well, but I just want to really reinforce the power of your presence as a healing factor. So in MI, we're speaking to the process of having conversations that potentially move towards change, and that the tasks that were involved in include engaging folks and helping them focus on an area that they're willing to talk about, being evocative around that area of focus, so we can start generating change talk that allows us to move into planning. That change talk is any verbalization, and it is a help seeker statement. We're not doing darn cat, they're doing darn cat. That moves away from status quo, the problem, and moves towards a different outcome, which we would call, in this case, change. And just in general, like, this is why we call motivational interviewing, as a way of having conversations about change. Although it's conceptually simple, it's been researched a lot, but it is a way of being able to have these conversations that appears to really show in a lot of context, to show a lot of efficacy, and that this spirit of MI is important for all conversations. If we're out of the spirit, if I'm not being collaborative, I'm not, really engaging with folks in a particular way, then it's unlikely that I'm going to, have productive conversations, because people have to feel psychologically safe. It's the micro skills that we're talking about that really help us respond to all aspects of help seeker talk, whether that's status quo or change talk. At some point, we want to definitely move into reflecting, affirming, inquiring, and supporting change talk more than status quo. And we've already talked about, reviewed all of these: open-ended questions, affirmations, reflections, summaries, and the ask, offer, ask as the primary interventions. And we have to be aware of traps, which is, if I talk too much, give too much information, the TMI trap, if I try to persuade, try to move too fast, or become unfocused, like, all of that can become problematic. And we know it's problematic if someone starts to wrestle with us, right? And we start to feel that pushing back. And instead, if we're trying to, be reflective and curious and in relationship, that allows us a place to where we can really be dancing with folks. And Arturo, just your comments, a really nice way of kind of finishing all this. It's like, we're really being so respectful and thoughtful. And I'll just say this: it's nice to be respectful and thoughtful with folks, right? It's, why would we want to be any other way? And with motivational interviewing, it's absolutely strategic. I mean, this is what we need as humans in order to feel safe and to actually take steps toward change. And the lasting change is that change that I, as a client, let's say, I as a help seeker, determine. And then your roles, you're the great support, and you provide the space, you provide the facilitation that's happening through your curiosity, your openness, your good use of skills. And I have time here for questions. I also, if people are interested, I can do a little bit of like reflective listening practice again, if folks are into that. I just love practicing skills. So if that seems useful, there seems to be no questions and there's some interest in that, I think I could do a little bit in 9 minutes. So I'm just going to pause right here and just see what folks would like. Yes, for questions or practice.
Yeah. Thank you so much, Dr. Dempsey. It's been a wonderful presentation, and please, everyone in the chat, if you feel free to drop a question, or if you want to do any of these exercises with us or with Dr. Dempsey. Nothing seems to be coming through. I really appreciated your reflection on how you can, oh, there is one: practice. Love to see some engagement, someone practicing using these skills, and if you could give some examples on how it is. So thank you.
Yeah, so you're talking about, so I'm not, it'd be hard to do in like 8 minutes for me to do like a full like little piece, although I'm always happy to do that. I'd have to have someone who'd volunteer to be a client, but I could certainly show some. But I do encourage people, like, if you like so YouTube and like looking at motivational interviewing, you'll definitely see some stuff. And there's also another free video on YouTube called The Rounder, which is like a classic. Just look up Rounder motivational interviewing. And you'll have a great example of seeing it all kind of come together. But if you want to, since I'm not hearing any question, maybe I'll just do this really quickly. I'll show you something. So one of you put it into the chat. might have been you, Andrew, who put in, nobody cares about me, what's the point? So one of the ways I think about this in terms of reflective listening is like, that's just like the tip of the iceberg. Right? I got this from another MI practitioner named David Rosengren, who has a great book on practicing skills. And it's like, just the tip of the point is, nobody cares about me, what's the point? What is the meaning for that person under the iceberg? And so maybe I'm thinking, for instance, for this person is, I have tried for so long and nothing works, right? What else do you think might be under this person's, like under the sea level? What else is under that we can't see? What else do you think that statement means? Nobody cares about me, what's the point? Feeling unappreciated, unseen. See if there's some other ones that come up. Unlovable. Maybe I'll say a couple more and I'll show you what to do with that. Scared of rejection, desires to be heard. Exactly. So for that one statement, there's probably more that are going to pop up that you think of. Like there's all these different things that could be underneath the surface that we don't see, but our context will help us figure that out too. Like we get an idea of the whole story someone tells us. So in order to do a reflection, I kind of think about like this idea of nobody cares about me, what's the point? That's just the tip of the iceberg. And then what's underneath is, I'm feeling unappreciated, unseen. I feel unlovable. I'm scared of rejection. I just want people to hear me. I've tried for so long and nothing works. So what I say back to the person is, thinking of these meanings, I basically use you statements in this case as a reflection back to them. So you've tried for so long and nothing works. So I'm getting the sense that you're feeling unappreciated and unseen. Right now, when you're thinking about nobody cares about you, what's the point? Like you're feeling really unlovable. Like no one loves you. Yeah, I get this sense that not trying is because you're feeling really scared of rejection. Given what you just said, it feels to me like there's a real desire to be heard. Right? Those are reflections, right? And it's reflections on what's underneath that. We're not exactly seeing, but we know like that's probably all could be a possible meaning from that one particular statement. And it's really powerful, that kind of tracking, because they're all kind of continuing the paragraph. They're all a little more complex because they're not on the surface. And that's the way of thinking that through. So if you're wondering a little bit more about how to do that, that's a way you can start to think about doing that reflective listening. For most of us who go to trainings, increasing reflective listening could be a great next step in your practice. If you can get to a ratio of 2 reflections for every question, you are getting to be what we consider in like our MI, competency kind of guidelines. Like that would be a target, and if you can do more, that's even better. But if you can do like 2 to 1, 2 reflections for every question, you're in great shape. That's a great thing to kind of shoot for. So notice when you ask a question, can you reflect twice after you ask a question? That could just even be a little challenge for yourself if you're thinking about, okay, this is a way I'd like to improve. So
Perfect.
all right.
Thank you so much for that. No, I'm sorry to cut you off, Dr. Dempsey. Go
No,
ahead.
I was just gonna say a couple more minutes if there's any other questions or thoughts or feedback.
Yeah, wonderful. Really learned a lot today. Just want to ask, your feedback, or state that your feedback is important to us. Survey attendees need to opt into the 90-day survey so we can collect your emails and send out those certificates of completion. The completion of the survey is vital to our quality control and the future funding of this project. It allows us to continue to provide you with training and technical assistance at no cost. The survey link has now been dropped in the chat. Thank you, Andrew. And please take a few minutes to complete the survey. Your time and feedback is greatly appreciated and valued. This is the references that Dr. Dempsey listed, and these trainings will be hosted or posted on the M-TAC website. once they are completed, edited, and then uploaded. It usually takes about 2 weeks. Thank you again, Dr. Dempsey, for everything you shared today.
Great. Thank you so much.